But that parent still was just in denial. She said she just cannot. And one day she called me and said, you are bold, because she wanted to treat the other child the same way as the first, and she just couldn't accept that. I'm just saying everything in one because I know we have a lot, to say. But having moved her and found the institution that was best suited for her, it was such a remarkable change. But then they understood clearly that all of these children they have different learning styles, they have different, and there was this lady, this teacher at the institution. She was amazing. It is just like an understatement. How she got to them and through to them, it was something else. And she was reaching them all like at their needs. She was a little one. And yet her methodology, her everything reached each and every one of those children. She dealt with them individually, even though they were in one class. And they found ways of stimulating them. Music does a lot for them. For many of them, they will, they will calm down. They will, they had different behavioral issues. Some my daughter would like retreat. If things aren't going in her way, she would just shut down completely. She would not engage anymore, speak or so on. I mean, she may just be crying and you don't know why, just silent tears, just not the real ball, or she just, and what's happening and she's not saying anything and so on. And I had to find a way to understand how to get through to her. And I had to find the things that worked for her. Now, one thing I recognized was that if we are entertaining, and there we have a lot of people there, if she is not the center of attraction, then she gets in herself and she moves away and she gets in a whole different world. But she's not included in the conversation.
All right.
If what I'm seeing also is that if she's not,
Sorry, Miss Sharon.
if yeah.
Just a quick question, just to not be, to have an understanding and not contradict. So our way may be different from the therapist way, but we are paying the money to see the therapist. If it is that we are not doing what we need to be in line with the therapist, are we wasting our money? So even though we need to find out what's best for us, if we're doing two different things, which our specialists had indicated, is going to be contradicting and confusing to the child. So in my method of reaching out to her in my space, she responds, but that's not how you do it inside therapy. And when I try your therapeutic method at home and you don't respond, I'm going to do it how it works for me. But it's still doing a mixture of things, and I believe it confuses the process in terms of what is the right way and the right thing to be done. So that's just how I don't,
Okay, I think I might have missed that part where you were speaking about the therapist versus, because I picked up on what I think it was you, and someone who was speaking about working with the child and not. So I get it now. So yes, there would be some amount of confusion there, and would confuse the child. What where are you going? And like you ask the question, really, am I wasting my money? I didn't do therapy like that. I just found two right schools, really, and they just had the right approach and the right methodology, and all of the teachers are really great in the area. They know and they put them according to the, it is just amazing. I can be free to call that school because I advocate for persons who have children at that age group level to send them there. They will not regret it. They will not waste their money. They will not. I can say Genesis Academy is an amazing institution.
And
For that we
Sharon,
were at,
just to
for
add
that
as
we,
just to add as well, Beanie said before that you have to let the therapist work.
yes.
If it is that we're letting the therapist work and it's not working at home and we're doing our way, are we really letting the therapist work? Because we are clearly changing what it is that they're saying that we should do
Mm-hmm.
There
at
has
therapy. So how it is, that's a point that I wanted to highlight. You said let the therapist work. They're the professionals. Because I know oftentimes we as parents, we want to do the best thing for our child, but if we're going to let the therapist work and everybody is not on the same page, that is where the problem comes. So we can talk about the different schools and we can probably say something to the teacher, but if the teacher does not understand that, hey, I am trying to understand as an educator, as a professional, you need to be more patient because you know what's really happening. I'm trying to understand. I am the parent. This is my personal investment.
And then that's the
Mhm.
importance of an individual.
So let me
educator.
ask you, the discussion, let me ask though, the discussion with the therapist, are there timelines?
I can.
Because that again, I would think would be important.
They cannot provide timelines, for example, in occupational therapy and ABA therapy, because what we know, so for example, ASD, the autism spectrum disorder, is a spectrum. You either have level 1, level 2, level 3. For persons who have dyslexia, from persons who have Down syndrome, persons who have a global developmental delay, they will respond differently based on the therapies that are provided. So I asked the question, when can I expect positive, like a positive change? They could not tell me. So for example, can I say a year? It's hard to tell.
What I would like to say about that, and I'm sorry, I'm gonna let you go. I think that, like I said, it's not a thing where you can say how it is.
I'm not hearing that person, so.
Oh, I'm sorry. Can you hear me now? Sorry,
Yes, much better, yeah.
I don't think it's a thing where you can give a timeline,
Yeah.
but interventions need to be made. That's part of my, where I'm getting upset and my, backlash that I'm having when I'm working with the schools and working with parents is that you cannot tell a person that this is happening to their child with no data.
Yeah.
That's one. That's a big issue for me where I get upset. Because you're now saying things just based off of whatever.
Yeah.
I need to see the data. You understand what I'm trying to say? That's one.
Yes,
And
yes.
then number two, if you need to give a parent a time in the sense of not to say I'm gonna solve the problem. Well,
Yeah.
because we're gonna pivot to a new intervention. Why is that? Because we can't be doing the same thing with this child for 2 years. And see, we've been trying to
Yeah.
teach, we've been trying to teach Mark to add for 2 years straight. And what we're doing the same. I mean,
Yeah.
we seeing that we trying to get Mark to add with vitamin waters. And we trying to get him to do 2 and 2.
Yeah.
And we've been doing this for 2 years, okay? 1 and 2.
Yeah.
It's been 2 years. This strategy is not working.
Yeah.
And so
The
therefore,
teachers
we need to do
implement
something
our
called an intervention.
Yeah.
And so we're not using vitamin water anymore. We're gonna have a meeting with the parent. We're gonna say, listen, we're not using vitamin water anymore.
Yeah.
After 3 months, we realized this is not working because what do we all admit? We've all agreed that
Yeah.
it's a different way of learning, right?
Yes.
So what we need to do is now just do different strategies.
Yeah.
So this strategy doesn't work. This is not working for him,
And-
right?
Yeah.
And now we're gonna maybe use a composition book or whatever the case may be. I'm just using random examples, but you can go
Yeah,
ahead.
so it boils down to partnership, right? There has to be a partnership. The process that we use at Gifted Stars is partnership between home, therapy, and school. If we're not all aligned and connected, it will not work. Whatever is happening in therapy must happen at home, and same thing must happen at school. All three, we have to be in a marriage. It's a 3-part marriage for the sake of the child. And if I see something happening at home, I should be able to pick up the phone for my therapist and say, hey, you know what? New development. This is working, this is not working. when we come back to the next session, can we do something else, right? Same thing at school. Teachers should be able to pick up the phone and say, hey, look, we saw some improvements and we're not waiting until the next report card. We're doing it right now. We saw some improvement, we're not seeing the improvement, mommy. What's going on? And then we all come together and say, hey, so for me, I am doing a test on my son, right? Wherein normally for my company, I always share reports to the therapist or the home. Now I am doing a report at home because what I am doing, there's no right or wrong way to do it, but I am using him as an example to say, what if I try this method where the home also provides a report? Can that help with the therapy session? So same way I am sending a report for my shadow being at school, I am also putting a report. I am making notes at home. He does something. I said, okay, yeah, that's a good thing. I see an improvement right there. I make a note of it and I do a report. If something goes awry with what I'm doing in terms of the strategy that they're doing, then I also put that in my report to say, I see this at home. I also see a report where it's happening at school. Hey, therapist, what's going on? Do you need to come at home? Do you need to go to school? What is it that we need from you in terms of this partnership so that I can continue to see the improvement?
And I don't want to be a jack of I wanted to add something because it's associated with what she said.
Yeah.
And this is what I see when I'm, like I said, when I'm traveling to other countries that's not United States.
Yeah.
IEP. I'm going to these schools. You cannot have a child that you're saying has special needs and they're going to see therapists. And we don't have an IEP. This is like completely asinine. You know what I mean? Like, it makes absolutely no sense because what the IEP does is what Cornelia is saying. The IEP does this. It's connecting you, it's connecting me, it's connecting you, it's connecting. I mean, what are we doing? And then that goes into the lesson plan. Now me, I wasn't a trained teacher in Jamaica. When I was younger, I used to have Jamaican teachers are immaculate, right? And because of that, that's why sometimes they can be very particular about taking advice on strategy. Because their strategies do work. We're not gonna act like there wasn't, their kids in Jamaica are very intelligent for not on accident. The teachers have a model that they were using. The unfortunate part is that it doesn't really go with what the new type of child that's coming up. Now, why I'm saying new type of child was having a short conversation with them. We are saying genetics can be a factor, but we have to be realistic about the environmental changes. All kids have small behaviors, and I've been working with kids with special needs for 15 years, so I can't lie. I have to talk based on my experience. Majority of kids have neurodivergent behaviors. Now we can sit here and pretend, oh, this one is normal, this one is this, whatever. And that's a bold statement to make. I'm telling you based on my 15 years of experience. Now maybe most of my 15 years was in the United States. If you go to Ed Weekly or Ed, there's an article, 1 of 5 children in America are neurodivergent. So tell me that makes sense. So how long are we gonna pretend like we have to incorporate special education as a whole in any school? Now, a lot of people will say, oh, I'm a special education teacher. That's why I'm saying that. Special education doesn't mean, it's like we have this negative thing about special education. All special education is accommodations and instructional strategies. I'm like, oh, Tommy, he's, different tools that are used. We have to be realistic. The kids are not like when we were kids, because half the things we used to do when we were kids, they don't do now. So I don't know why we're still judging them the way we were.
And that's why I'm saying to you that in Jamaica, the teachers are not equipped. And I've been saying that, but I've been ignored. The teachers in Jamaica are not equipped. Like, for example, after posting an episode doc on autism that we did the other day, and someone reached out to me about their child, and all they do is kick the child from school, saying that the child has bad behavior. That's all they do. Like, they are not willing to work or even say, call a parent in and say, listen, I realize that your child is not doing well in this area, or your child is not this active. Maybe you need to go and get this test done to find out what's going on with your child, if your child is autistic or your child is on the spectrum, or whatever it may be.
But you said it earlier, it's the special education awareness.
Exactly,
We
and
gotta
that's
keep
one of the
working
things
on
that
that,
we
yeah.
need to, I think we need to work on, and that's what Doc was talking about. The government needs to be more involved
I
and
agree
have
with
this.
We're going
Second
to
thing,
jump to that.
exactly, second thing, because that goes back, that takes us back to what we were talking about the classroom. When we're talking about the classroom, is it a private school or a public school? Because in a public school where you have teachers with up to 40 students in a classroom, so the first 15 at the front of the class is actually learning, and they're grasping all of these concepts that are being taught from the curriculum. And then now the majority at the back, you know, you have children, you have the rude bunch, the hyperactive bunch, all of that. So if the teacher is at a level where they're not really understanding that something else is going on prior to the learning concept of what is happening, they need to be aware then that, look here, Tom Jones can't come every day, come take off his shoes and socks and in the corner smelling it.
That's an
Can I
attentive
say
teacher,
something?
because sometimes.
Yeah.
I'm sorry, go ahead. You want?
Yeah, that's an attentive teacher, because sometimes a teacher might have, because I've seen that in cases where a teacher have 40 students in their class, but that teacher is so in tune that they know, okay, so today Mary is at school, Mary didn't do any work. Tomorrow Mary comes to school, Mary didn't do any work. Tomorrow Mary comes to school, Mary's in a corner by herself, and the teacher will call the parent in. So that's why I'm saying, I think it's the teacher and the level at where the teacher is at in dealing with the children.
I just
I
wanted
want to talk about that in regards, me, Mia?
No,
Just let
because
me
I
just-
wanted to mention it based off of what you said, because I'm
Yeah.
old, I'll forget.
Oh, go ahead, go ahead.
I'm just telling you that I'm old. I'm just throwing myself under the bus. I can't my brain.
So what I'm just saying is that, I almost forgot right now. What I'm trying to say is it's a classroom management issue. I'm gonna admit my own personal, I've been struggling with my son as he's shifted. He went to school in Nigeria for 2 years. It was a great, went well. He's come to Jamaica, and the problem, I would say, and I'm not gonna say the problem, I love Jamaican teachers, I wanna say that first and foremost. I don't want people to come for me. I'm trying to say that, I went there, I volunteered at the school, I did social emotional learning activities. I realized I was trying to do everything because I'm not gonna be rude, I'm from this culture, right? I literally had to tell the teacher, it's a classroom management problem because it's not just my son. But when I come in here to sit to you, I'm trying to tell you, okay, what's the intervention? What's the this? What's the that? I mean, you have a parent who is an education specialist that's saying, listen, I'll come here as a second teacher for free. And I'll do this, blah, 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 blah. And the resistance to, and why I'm saying this classroom management, we're doing classroom management from 1977. This is what I'm trying to say, because we're talking about neurodive, right? So if you guys are with me on that, what I'm trying to say. So if 1 of 5 kids, oh, is it? Oh, and so what I'm trying to say is that a lot of the teachers, what they're doing is, their classroom management skills are from the veteran teachers from 1977. Now, guess what? Those are great classroom management skills if we don't have tablets, if we don't have food that's over-processed, and we have kids that go outside and play every day. So a lot of them didn't need the OT because they're doing all of the fine motor skills that we were doing, right? But this classroom management has to change because you can't keep Johnny and the 5 group of kids. It's not them misbehaving. It's the classroom management cannot engage the children.
So,
You understand what I'm
yeah,
saying?
I want to say something.
no problem. I just want to add to what Nene
It
was
goes
saying.
back to, God forbid, but I'm gonna say, it goes back to reverse psychology as well. For me, when I,
After you speak, then we're going to take some from the online person. And that
yes,
wants to come
yeah.
in.
For me, what I do is, it's just something that I do. Okay, so it's break time. So I quietly, because I don't shout. So guys, it's actually 10 minutes and 8 minutes for break. Because many of them will take the stand, they don't need to buy anything. And then now at the end of the day, I say, please so quietly go and relieve yourself. Go to the restroom. Because when you come inside, I'm not letting you out. Because I took about 2 weeks to assess my class and I realized that there are 3 boys in my class, especially when I go to the board. Because when I go to the board, especially when we're doing math, everybody's going to the board. So you have 3 boys, that's when they want to do release, the Ed Earthing name. So I simply say, boys, especially, you know yourselves, go and relieve yourself, because when you come inside, then you're not going to go back outside. And I do that lunchtime. And in the morning when they come, I do that before we start. And then when school dismisses, I do that again. And then I said, you are allowed 1 emergency. So I kind of, to manage the class, because I can't have the class where, oh, miss, and then I'm stopping.
Can I
You
offer a tip really
understand?
quick and then kill it on it?
Yeah.
Okay, this is an example. Let me give a tip, because I don't want to be that person who never gives an example, but I'm telling like this need to change. Okay, sometimes what the math segment would look like is a child's craft. It is described for math, not you. That's how neurodivergent kids are. So every day, there's gonna be a kid to say, I want to be the child who's writing the math on the board as like that's how we gotta look at it. It's a different, education is different. And that will get the kids to pay attention because they're like, oh, Tommy's up there writing.
Yeah.
And now all the kids are watching. And you're just talking, and you actually can just sit in your chair. And you're like, okay, oh, Tommy, remember, here's the notes, take the notes, make sure you write it for one.
Yeah.
It's like we're working hard, but not working smart. That's why things have to be data driven. It has to be data driven, because why are you doing this? Because you're stressing yourself out. And some of those little boys taking a break, you can say, oh, Tommy, tomorrow you're going to do the history lesson. You know, no, I'm not saying you're not. I'm giving a suggestion for whoever's listening. You can give it to your teacher. That's free. That's a free tip. And every day, the kids, all day, they're going to say, oh my gosh, I want to be a person tomorrow. And guess what? That's the reward. That's a reward, but that's a healthy reward. Because I see the dynamic of what the day stand for rewards. That's a healthy reward now. And then everybody's like, you know what? And then now you're like, okay. And you rotate it now. Health first is the biggest when you're dealing with neurodivergent kids. We need to stop. I think also with like veteran teachers, it's like this thing where, you know, the old way that we think of teachers is not today. Because they can't work
Some
regular.
of the teachers are bullies.
Yeah, or
Because
like they want to be.
I give an example with my son.
Yeah.
All right, so my son was in a school before moving to a particular school. I'm not going to say the name of the school because I'm not the principal's favorite. So I don't want her to think I'm bringing down her school. But he moved to the school in grade 5. So this is a whole new environment for him. My son, his head is kind of shaped, kind of funny, like they call him peanut head at school. So you guys will have an understanding of what I'm saying. So my son is brilliant boy. And I noticed that at school he started to drop in his schoolwork. So I'm like, okay, so what's going on? Come talk to me, Papa. Tell me what's going on. He's like, Mommy, I don't like this school because I'm being teased at school. I went in and spoke to the principal, but the principal is such a bully. She believes that her school is perfect, and my son came in, and then all of a sudden there's some issues. So I said to her, Miss, I know my son and I understand my son, something is happening. And she was not okay with the fact that I came in, all of a sudden, everybody's gonna see my son as mommy's boy because I'm coming in and stuff. Had a rough,
like me and my son.
yeah, had a rough year in grade 5. Move over to grade 5, grade 6, sorry. Move over to grade 6. He and his teacher, best friends. He's his teacher's helper because guess what? She took the time to get to understand him, to know him, and then he settles and he's doing well. But at the same time, the principal is still bringing everything over from grade 5 with the fact that my son was in a new school, not completely settled, being bullied, and of course. So I find that within the school system, based on my experience in Jamaica, a lot of the teachers, they don't take the time to get to understand their children. Most of them are bullies.
But it's like going back to what you suggested, the ministry getting involved. Because the training is just needed.
So I wanted to ask a question to one of the doctors online. Is that the cause, as Mimi indicated, change in the environment? Do you think it's because of the food that we eat, why kids are neurodiverse now? So I'm not sure if they could probably give feedback from that response.
Oh, it's,
Okay.
sorry, go ahead.
Doctor, are you hearing us?
Yes, yes, can you hear me?
Yes.
So I'm Dr. Celeste Thorwell. I'm so grateful to be part of this symposium and to listen to all the experience and expertise, because I think only real world experiences will have to guide, along with some of the knowledge and the research, will have to guide the school systems to be more flexible in how they understand neurodivergence and autistic spectrum and other neurodevelopmental disorders, and also our societies need to become more flexible. We're entering a very different world than what we had as children, what our parents had when they were children. And in terms of the food, I think what we need to look at is the underlying neurophysiology of what's going on with the autism spectrum disorders. And so when you have processed food, we know that brains that are more vulnerable are going to react in a bad way to processed foods, in a more extreme way to processed food than a brain that is more quote unquote normally balanced. So from my perspective, which is the limited perspective of neuroscience, like I said, I think we need to consider this on all levels, but from my neuroscientist perspective, when I consider a child on the autistic spectrum or neurodivergent, specifically with autism, we know that their frontal cortex develops in an overgrowth. And so in terms of medications that they use to help that, they will use Ritalin and other stimulants that help the frontal cortex focus again. So Ms. Young Palmer was mentioning about her daughter zoning out when she wasn't the center of attention. While she was the center of attention, that gave her enough stimulation to stay in her frontal cortex and use her frontal cortex socially, because that's where social engagements become. But when she was no longer the center of attention, she became more withdrawn because that's not, she's no longer getting the input into the frontal cortex to stay attentioned and focus there. The other thing with ASD is a change in connectivity in different areas of the brain. So there's some very localized connectivity. So the first person who spoke about, you gave a car to the child and she would just focus on the steering wheel rather than focusing on the only car. So that's what we see at ASD, is that hyper-focused, but a lack of connectivity over the long range. And they're really looking now in the neurobiology into the amygdala, which is the emotional center, the cerebellum, which is your spatial arrangement, but also the corpus callosum, and it's like the bridge that connects the right brain with the left brain. So there's something in the ASD brain where the different parts of the brain are not speaking to each other optimally. And then most interesting is in the bloodstream, there's a lower level of oxytocin, and oxytocin is like a bonding hormone. So it helps with socialization and socialization behaviors, building trust, emotional regulation, cognition. For babies, when they breastfeed, they release oxytocin and helps them bond with their mother, and then mothers release oxytocin and helps them sleep. So what we understand about oxytocin is it's a master hormone for all the other hormones. So when we think of ASD, we can't only think about the nervous system and the brain and behavior, we also have to think about the hormonal systems and how the hormones might be dysregulated, especially the oxytocin, and then also the inflammatory system, because they found that there's increased inflammation in the cerebral spinal fluid of autistic children, and that again speaks to food and what we intake, because any processed food will also increase inflammation in the body. So whenever you have an increased inflammation, disrupting the nervous system, but also from my perspective, in terms of sleep medicine, is disrupting their sleep. So in sleep, we're seeing decrease in alpha rhythm, decrease in delta rhythm, and decrease in theta. And the new treatment, one of the newest treatments that is hot off the press with in Italy and Canada, is using low intensity electromagnetic frequencies that will help boost theta, which helps with focus and staying connected. That also helps boost alpha and delta as well. So those are some of the strategies from a neuroscience perspective that we're looking at that I hope to share the next time I visit Jamaica and speak with the Jamaica Autism Academy. But that's just a few of my comments, but so wonderful to hear the active conversation.
All right, Doc, one question. Do you believe a gluten-free diet, dairy-free diet, soy-free diet, does that help with a positive behavior from a child that's neurodivergent? Because I realize it's not fully scientifically proven, but persons say that a change in diet helps with behavior. Do you agree or disagree?
I completely agree about diets influencing not only behavior but emotion and sleep. So in the absence of testing, supposing you can't get tested for gluten-free diet or you can't get tested for sensitivities, then you try it. And if you see a difference in their emotion and their behavioral regulation and sleep, then you're going to adopt it. A lot of what we're doing right now with ASD is a lot of trial and error, correct? And you're saying to be consistent. But I think we lose nothing in trying these diets, but preferably they'd be testing beforehand. But if we can't, then we need to try them.
So I have a question, because my son is on the spectrum, but he's a very picky eater. There's limited things to what a matter of fact, maybe I can put on my finger 3 things that he will willingly have. And I get you, and Danae and I, the person that just asked a question, we've been back and forth at this for a very long time, talking about diet. But a parent like me who is just trying to get this child to put something in his mouth, it's very difficult moving him or shifting him to something else because he just might starve himself. What would you recommend in this case?
I would try and look for a supplement that gives the biggest boost to a nutritional value.
Yeah.
And whether they would take that in a liquid form, like juicing it, or see if there's some way, some form, whether you bake it or you do something, but to make sure that he has all the trace minerals, and especially a lot of the fatty acids need to come, because our brain requires more fatty acids than in general has been taught. So you're looking at fatty acid rich foods and trial and error of what he will take. Yeah.
Doc, I have a question. How does vitamin A helps with a
Vitamin D helps in several ways, but one of the ways it really helps is with sleep. So in terms of ASD, sleep has not been properly studied until the research that we've been doing in Canada and with the help of the Italians. But the good thing about sleep is we can see objective data of how things are not functioning, and then with certain strategies, how the brain is settling down again. So you get objective data of how the child is settling. And with the low intensity EMF therapy, we got autistic children who were nonverbal to become verbal, and many of the children jumped 2 grade levels with resynchronizing the brainwaves. So if you think of ASD as, the brainwaves are all desynchronized, how can we help to resynchronize them again? And like you say, consistent schedules, because it's a consistent approach with the therapist at home and at school, and of course that requires greater communication between everybody. But a lot of times children and our bodies are naturally attracted to the food that we're lacking certain key components in it, whether it be minerals or fatty acids. That's our body will be attracted to those types of food.
All right.
And with the brain not being settled properly and being not sleeping properly, it leads to a glitchy gut. So a lot of these children have issues with the gut, right? So another area of research is the gut microbiome now, and bringing up the issue of nutrition and the children being very particular about nutrition is another thing, another aspect that just hasn't been properly paid attention to.
All right, and just to add, you spoke about ASD. For example, my child has a global developmental delay. So her behavior is not the only issue. Her occupational therapy in terms of fine motor skills, gross motor skills is not at her age level. Her speech is not at her age level. Her physical ability is not at her age level. For example, if it is that she's going up the stairs, she doesn't alternate, or if she's going down the stairs, she doesn't alternate steps. So as it relates to a gluten-free, dairy-free, soy-free diet that affects the behavior and helps the behavior, does that affect development in the other key areas that she needs help with in terms of her physical help that's needed, her occupational, which is a day-to-day, routine?
Yes.
Is that diet change good for a global developmental delay person or individual? Or is it better for persons who have ASD, which main issue is behavior?
Well, I think across the board globally, maybe not the case in Jamaica as much, but across the board globally, diet is an issue for everybody. Our food is lacking nutrients more and more all the time because of processed foods, and the land's lacking rich nutrients. From my understanding so far of what I've learned about Jamaica is the land is still pretty rich in nutrients in compared to many areas in North America. I think what we need to do is all these efforts are being made, and having a child with global delays, the amount of energy and planning that needs to go into it is enormous. Making small changes in diet as indicated, but diets that nourish the nervous system as much as possible are what you want to focus on, with lots of fatty acids, so lipids, and fat absorbing, like foods that allow for greater absorption of nutrients.
Okay, all right.
Overall.
I will try that. But so, for example, now the pediatrician would indicate milk, but another therapist would say dairy-free. Who do I listen to? Who do I listen to in that case?
No, you have to listen to your child and what your child winds up behaving, looking. We're in a world now where we can take the information from different places, but very much what we're learning and neurodivergent children are teaching us is we have to take a case by case basis, and who knows their child better than their mother. So you get these options from the views of different specialists, but then you have to apply it to the real world, to the child that's in front of you. Yeah, and that's what we need to understand.
So and this is me just playing devil's advocate. I'm going to listen to my child, but not Sean.
No, not like in that sense.
No, I mean, you observe your child.
No, she means like how
You want to then you can observe your child's behavior and emotions and their sleep and see if it settles.
She needs to tell with her weight. But for the behavior
See how the child responds to the
it's
suggestion.
like behavior
And if the child's
is more important.
The child's nervous system responds well, that's wonderful, but if it doesn't, because there are other issues in their inflammatory system, in their nervous system, in their endocrine system, that isn't being considered by the pediatrician. The pediatrician can't possibly know every single child. It knows more or less what's in the norm, and how they're talking is from the norm, from the studies in the norm, but these children are outside of the norm. So you can apply strategies that are within the norm, but you have to observe what the results of those strategies are.
Yeah, at the end of the day,
He
Alright.
has a doctor
Um,
who says.
So what should actually happen is that we call them case conferences, where everyone who's a part of the treatment of the child comes together and have a discussion. That way, all interventions are aligned with each other. We don't have that a lot in Jamaica,
Yes.
right?
I
Because
know that.
private practice will say that they don't have time to reach out and stuff. But really and truly, for your child, you're obligated to a medical report that you can carry to whichever physician or person doing the treatment for them to read, and then they can make a decision from there. So I can tell you from working at the Bustamante Hospital for Children, right? You don't need milk to gain weight, right? That's
Okay.
something that we treat all the time at the hospital, right? And of course, there are children that can't drink milk. One of the easiest ways that we increase calorie consumption is adding coconut oil
Okay.
to
Don't have that.
beverages, right? Because a teaspoon of coconut oil can give you up to 300 kilocalories per serving, right? And sometimes you add 2 teaspoons to a drink, and they can have this drink up to every 4 hours for the day, and that will help the child to gain weight.
The reason I asked the question that particular way, because we have identified that we are not on the same page. So for example, if it is that my pediatrician is saying this, she doesn't agree with the no milk. From her professional experience or years of experience, as it relates to the other global aspect that is affecting my child, where her weight is on the borderline for underweight.
but there's
How
always
do
substitute.
you? No, but then that wasn't provided. So
That's-
it comes
No,
back to
and
that.
that's
now.
this is why,
comes
as
into
a
tangent.
parent, it is also good for you to do your own research. Because at the end of the day, remember you spend most of your time with your child. So you are the person that knows
Yeah,
more
but
about your child.
I do that, but in light of the fact that we're saying let the professionals work,
Yes.
how is it that we create
Also,
a balance there? Because
there's-
I can research and say, hey, you know what, there's something else. And
Exactly,
the
so that's where
pediatrician
you come-
still has something otherwise. Who do I listen to? Somebody that is not trained? No, this is the issue that we're going to face when we're talking to other people.
Mhm.
By law, practicality, who do we listen to?
Alright, so if
Do we
we're
listen
going,
to the professional or someone who has the first child, only child, that this is the way forward, where you have a lot of case studies as a doctor? Say, come back now,
But you have
what
to-
do we
At
say
the end
now?
of the day, you have to follow your heart and your passion. Because remember, alright.
Yeah, but
For
if you
example,
follow the
like my
heart and
mother would
passion,
say-
you're not listening to the therapist.
Remember, my mommy would say, doctors would tell her, oh, don't give your children bush tea because thing. But at the same time, she would say, well, there was nothing wrong with me getting a little bush when you guys had a cold because you guys are still here. So sometimes as a parent, we have to follow our hearts in it. And we have to do our own research because we spend a lot of time with
Yeah, but
organs.
I don't, what I'm adding, to just add quickly, the pediatricians are important. We can do our research, but
No,
we
we never
won't
said they're not
know-
important,
No, I'm not saying that you're not saying that you're not, but in light of the fact that they're telling you from a medical perspective that that is supposed to be done, and you're going to say, no, let me try something different. Is that a deterrent in terms of you as a pediatrician, you as a medical professional in terms of helping us? Because, for example, the bush tea thing, I've heard that statement before, but then legally, the medical professionals take an oath. They have to.
Remember, you have
Be-
different type of
we
health professionals, you know. You
Yeah,
have
but then
holistic care.
who is the standard? Where's the standard in terms of this
Ev-
neurodiversity?
Everyone
thing?
have their own standards.
Yeah, but that's the problem.
Alright,
Because
so-
I could be saying something and you could be saying something. Who is right? So somebody listening onto the panel now, who do they listen to?
each person treating the child or adult has their own importance, has their own limitations, right? For us practicing in medicine, right, we have our patient charter bill of rights, right? Now I can tell you that in medicine, there is no one definite way to get to a solution.
That's
So if I can say milk and your occupational therapist might say, no milk, and you come to me and you explain why, I can get the report, explain why, then there, I have to look into other avenues. Remember, as the parent or as the adult, treatment all comes down to you. I cannot force you unless it is life and death, right? And you're obligated to second opinions. You're obligated to doing what you see as the best interest of your child. So that's where engaging conversations, you have to engage in so that we can all come together on a common ground to get at a goal where each person some might have to compromise, but each person can get the best out of one another.
And that's why I agree on what you were saying about the ministry having to get involved, because when you have a child and we have to also be empathetic. Like me, I've been doing parent communication, like I said, for over 15 years. It's like if you have a child and they have a thing going on, it's like, it's hard to say, yes, I understand the rationale of everything as a professional, like, oh, just do this. It's different when you have the child, because now what you're saying is, I have this child, you go home with this child, and when you realize this child has these problems or these differences, you're like, who do I go to? And that's the question I see what you're asking. So that's from her perspective, but I also, as a professional, I get totally what you're saying, which makes a lot of sense. And I admire how you communicate, because a lot of professionals don't understand that. Because when you're dealing with parents that have children with special needs, you see how your tone is and you're relaying it to her, very like relaxed. I think maybe too, there needs to be like a sensitivity course on like speaking to people who have children with special, because I understood everything you're saying, what you just said, and it was a great explanation, it made a lot of sense. And you basically just gave her an answer. You told her, listen, if you come to me, it sounds like if you had a parent come to you and a therapist told you something, you would say, oh, you know what? Okay, bring me the document, let me see. And then as the medical person, you would say, okay, we have two options. So these are two non-milk options, and that's what we need more. We need more professionals who understand that, yes, as parents, obviously cultural too, Jamaican parents are very good, very involved parents. Yes, you make the decision. And that's also cultural, because I tell a lot of people when I'm in the States that I can see the community. They might not have the structure here, but the community is actually what's saving these children, in a sense. Like uncle, aunt, cousin, this, that. And in the meantime, we're just filling in the blank with the support and the love. But at the same time, like, if you come in and you don't know anything about this, you're kind of like, they'll come to you and be like, sir, what I'm gonna do? You know, so that is kind of like what it is. It's kind of like, I talked to this person, who's right? They're gonna have that mindset, because it's like, I don't know what to do, and I just want my child to be okay, because we also haven't talked about that, and I don't know if we are, about this thing where, this blame thing. Like, when you're in a family, I'm Jamaican, I know, right? Because even when I took my son to speech, when he was 2, and everybody was like, I don't care. Luckily for me, I'm a special education teacher, so I don't care. I'm like, whatever. Because to me, therapy is like tutoring. So in the long run, if he grows out of it, he doesn't grow out of it, it's still beneficial. There's no harm in going, but culturally, everybody's like, oh, you're going to speech? What are you going to speech for? I'm going to speak because I think, I'm seeing some things and I just want to check from a specialist. So, not to get too much off of what you were saying, that's part of the problem too. It's so many areas, is what I'm trying to say. And the good part is the conversation. Because I know I think Cornelia said the cultural thing, and I'm like, this is like a good start. That people are actually having a conversation, that even there's a room full of people who understand how to communicate without a judgment.
Yeah.
That I think is the beginning, because I think even in first world, like United States or Canada, there was a time when it was like this.
Miss Arlene, I have a question though. For all of us here coming together, speaking on this panel, where do we go from here? Because a lot of what we're discussing, I'm so sorry that the Minister of Education is not here, especially when we're talking about the curriculum and how rigid it is.
Well, it's going to take a lot more sessions like this and a lot more events and, just putting it out there and letting our voices be heard.
Yes.
And you know, just to spread awareness and let them know that it's not just one person or 3, 4 families, but many families out there
Yes.
with, you know, that are facing challenges because they don't know.
Yeah.
So it is
I think
more
they know.
things like these we have to put out there.
But the
I don't
but the
really know
people
the
have
depth
to.
of
Then
it.
what
I think
I
they
don't,
know the depth of it. But as they say,
what I don't appreciate with the
For
go ahead.
Alright, so for the education sector, well, for most ministries, you have a specific department, right, that charges the lead for policy shifts and changes within the ministry, right? However, this is not done over the course of a day, a week or two, right? These policies can take sometimes up to decades to be in effect, right? Because you have to have a foundation which involves research, right? So that there is data on why you're doing what you're doing, as well as you have to have qualified persons to charge this policy, right? Our issue now in the sector is that we don't have a lot of qualified persons that are one, dedicated to assist the ministry in assisting the ministry in leading this policy change. Right? So it's good that there's a forum now that you can voice your concerns, right? But it's going to take a lot of forums on a wider
So this is
scale.
going to be a quarterly panel discussion. So every quarterly we'll have a discussion. It's not going to be the same day.